a New York Times article just came out. Maybe some of you saw it. There was a graph of how many deaths by country per 100,000 population, right? Of deaths of 100,000 COVID infectants, and what how many died, like what's the percent, and how many died, and the graph went by country. And if you saw that graph, what was interesting to see was a lot of these poorer countries within Asia and Africa did much better than countries like the US, the UK, Germany, Italy, and other European and Western countries. And you got to think, well, how is that possible? Because historically speaking, right, when you have some sort of health crisis, pandemics, usually it's the poorer countries that get affected the most. So this New York Times article, it attributes to, the U.S. has a higher age population, right? Where our average age is a lot older than these other countries. There may be a lack of reporting of deaths in these other poor countries. These other countries were very strict in terms of international flights, especially with China and Europe. They basically blocked flights coming in immediately. Maybe that has to do something with it. And the answer is, I think it's yes to all those, right? It's yes to all those. But there's one thing that the New York Times didn't mention. It's obesity. Okay, it's obesity. Guys, did you know that in America, 40% of adults are obese? 40%. That's right. 40% of American adults suffer from obesity. Now, we don't like to talk about obesity, right, in 2021, right? We don't want fat shame. We don't want, body positivity. We don't want to talk about obesity. But the truth is, with obesity, right, it's a medical issue. You have other things that come with obesity, right? Diabetes, heart problems, artery issues, and a host of other things that can go wrong when you're obese. So when you have 40% of Americans that are obese, and you're inviting all these coronavirus comorbidities into your lives, and you die from corona because of these comorbidities that you had from obesity, then maybe we should talk about obesity. Maybe we should talk about, Americans, we need to get healthier. We need to exercise more. We need to take our vitamins. We need to eat healthier. We need to be more active. Maybe that needs to be talked about more. Because in terms of when you see, what are the best ways to prevent COVID and getting really sick from COVID, nobody's talking about personal health. Like, it's a taboo thing to say, hey, make sure you're healthy. Hey, make sure you're active. Hey, make sure you're eating well. Like, it's a very taboo thing to say that publicly. And my point is, it shouldn't. When you're talking about, the US, right? The richest country in the world that has extraordinarily high death rates compared to other countries, you got to see that and you got to say, well, where did it all go wrong? And don't blame the healthcare system. Okay? There are countries with virtually no healthcare system, and they're performing much better in terms of COVID deaths than the US. So it ain't the healthcare system. All right? It's not the healthcare system, guys.